All right, this is gonna be a raw one, so if you're not around for that, then you can leave. I'm Amber, and I have endometriosis and polycystic ovarian syndrome, and I am processing that right now. No, this is not new. I've had it since I was 15, diagnosed with PCOS at 21, and my life has been full of pain and surgeries and hormone pills and experimental drugs. I was watching a video of surgeons removing stage 4 endometriosis, and then hearing how difficult the surgery is and watching people have stoma bags, like a poop bag, because they had bowel resections, and how it's 2026 and we're just now being classified as like a disability. But like my whole life I struggled with severe pain. And like I would say I'm hurting. I would say that you don't understand how much pain I'm in, but like it's everything. It's all of my body, feeling like your body is betraying you. I'm just so tired of women being ignored. I'm so tired of pain being dismissed and just being told that periods are supposed to hurt. Like, missing a week of school when I was a kid was not normal. And like I have to push myself as a provider, as a therapist, to like push through the pain so I can be there for my kids because the kids need me, all while I am in debilitating pain. I've been trying the medicine that has been going around with like, I think it's the Zyrtec and the acid reducer, Pepsid or whatever, and it's like I didn't really notice any difference for me. I don't know how long you have to be on it for. I want a cure. I want awareness. I want treatment that is really effective, and like I don't have to keep going back and back and back. I had my last major surgery in 2017, and I did it because I tested positive for the CA125 gene, I guess, during a screener, and there was a concern that it was cancer, and it was endometriosis. It wasn't cancer, but it was a marker for inflammation. So I was referred to gynecology, gynecology, and they scheduled the surgery. And when they went in, like they thought my left fallopian tube was dead because it was adhered to my abdominal wall from endometriosis. And thankfully it wasn't. They were able to like clear it out and get it to still work. And it was such a painful recovery. It took 12 weeks to recover for her. And as a therapist, like that's hard. That's a hard thing to do. And all I keep thinking about is how many people can't afford the care. How many people can't afford to take 12 weeks off? How many people can't afford to rest and keep their bodies down for 12 weeks? And I had an employee who had severe fibroids, and she was in so much pain, and all these other circulatory issues as well. And it was just like, she couldn't afford the surgeries or the time off. And I don't think it's fair. In America, I don't think it's fair to have to pick between being able to pay your bills or have pain relief. And another thing that most people don't know about me is that I also have PCOS, which is why I've struggled with weight throughout my life and hormones and everything like that. And in 2022, I discovered Mounjaro. It was a GLP-1 medication, and you know, PCOS is kind of like female diabetes. You don't process sugar the same way. And this medication helped me lose 70 pounds. Now, the 70 pounds was great. Like, high five, I looked awesome. But I didn't have pain. I didn't have pain for the first time in my life, and I have been diagnosed with lupus and fibromyalgia and eosinophilic esophagitis and gastritis and all these different inflammatory diseases, IBS-D. I have so many inflammatory diseases, and a lot of it's from trauma because it's suppressed. The body keeps a score, and I had suppressed pain for so long that it manifested physically in my body. And I took this medicine, and it helped for a while, and then insurance told me I could no longer use the coupon code. They were denying it anyways, but I was paying $25, and they said I couldn't use the coupon code anymore. And after that, I had to go to generic, off-label, off-brand from a compounding pharmacy because it was going to cost me like $1,100 a month to keep getting Mounjaro brand. And then when I did that, I experienced anaphylaxis multiple times because I tried different compounding pharmacies. I thought it was my fault. I thought I did something different because it wasn't an auto-injector. and I almost died. So after I was unable to have Mounjaro because my insurance company, even though they were not paying for it, denied my coupon code, the off-brand label stuff tried to kill me. Then I stopped using it, and then the weight started coming back because I have PCOS. And I just think that women's health is not prioritized in this country, and I think it's a fucking travesty. And I'm tired of it. And as a woman who's in healthcare, who is a CEO and a clinical director and a high achieving person, highly intelligent person, like, I know we can do better. And in 2020, I helped pass an amendment to the CARES Act to help telehealth be accessible to all therapists across the country. So, like, if you did telehealth as an OT, PT, speech therapist, feeding therapist, audiologist, that was me. Hi, I'm Amber. Like, I know the power of one pissed off woman. I was so pissed off that I changed legislation that helped people get care and access to care, especially in rural areas, and prevented people from losing their jobs. Like, I just want there to be changes in women's health care and healthcare in general, but in women's health care, because we deserve better. We are the life force behind this country. We are the nurturers. We are the lovers. We are the mothers. We are the ones who help to breathe life back into our homes and into our communities. Like, women are so powerful, but we are suffering in silence. I'm fucking tired of it. So I am trying my best to heal my body from the inside out. This has been a spiritual journey for me, but it is a deeply physical one because I have dealt with physical pain my entire life. And I hid it from most people because it's uncomfortable to see someone like this. Like, if you've stayed this long, no one does, because seeing someone cry on the internet's not really entertaining. But I hope this touches one other person who's going through chronic severe pain, and you don't feel alone. I see you. Endometriosis sucks. PCOS sucks. Like, lupus sucks. Fibromyalgia sucks. All these diseases suck. But I know there's a better way, and I know that we can heal. And if we can just start putting money and resources and funding into women's health, because all these research studies are based on men, including autism, for shit's sake. Like, my daughter, who's like, Mom, did you know that all of the research for autism is mainly tied around men? I'm like, yeah, so are all the medicines, and so is everything else. Like, can you please just study us? Like, tampons weren't even using real blood in their studies until recently. Like, what the fuck? This topic makes me mad because it's so personal to me, but I don't know, I just needed to talk. I needed to get this off my chest. I am tired of living life sideways on a heating pad in my bed because I'm in so much pain. I'm tired of it. I want real help. And I think all women deserve real help, but I don't think that we should have obstacles to our help, to our health care. We should be able to have that paid for. We shouldn't have to worry about feeding our families and paying our bills when we're trying to get pain relief. If you've made it this long, I love you. We're in this together. I know there's hope, but it starts with talking about it, so I'm uncomfortably talking about it. I love you. We're in this together. I'm gonna keep going. Please keep going too.